Hi guys, Dr. Kid here. In this video, I'm going to go through the key things that you need to know before you start the medication Duromine, otherwise known as Phentermine. So what is Phentermine? Phentermine is a tablet that you take once a day and it's used to help people with weight loss. It helps you lose weight by helping suppress your appetite. Phentermine is sometimes termed a sympathomimetic, meaning that it mimics a lot of the effects of the sympathetic nervous system. Interestingly, it gets its sympathetic effect because it has a similar chemical structure to amphetamine. Unlike amphetamines, it does not seem to have the addiction potential, and in all the patients that I've used it on, I have yet to see a single patient that has become addicted to phentermine. So who should not use phentermine? The people that should not use phentermine include people that have heart disease, uncontrolled high blood pressure, glaucoma, hyperthyroidism, or if they're pregnant or breastfeeding. So what are the side effects of phentermine? Well, common side effects of phentermine include inability to sleep, tremors, palpitations, dry mouth, and constipation. In my experience, the effect on sleep seems to be the biggest side effect that most patients complain about, and that is why I usually recommend my patients try and take it in the morning when they first get up. So what dosages does it come in? Well, it comes in dosages of 15 milligram, 30 milligram, and 40 milligram. Like with any other medication, if you haven't used it before, it's best to start with the lowest dose to see the effects first before increasing it. So most importantly, does it work? Well, in short, I would say yes, it does work. And I want to give you some typical results from my experience. Just to give you a rough guide on what I typically see when I put patients on this medication, I usually see the average person lose between half to 1 kilo a week, usually for the first 1 to 2 months when starting this medication. Now the results obviously vary between people and there are many factors that affect this. One of the key factors is how heavy you are to start with. So if you're 200 kilos, it's much easier to lose 1 kilo than if you're only 100 kilos. Because if you're 200 kilos, 1 kilo is only 0.5% of your body weight, or if you're 100 kilos, 1 kilo is 1% of your body weight. So when you are losing weight, try to calculate your percentage weight loss. That way it doesn't look like you're actually losing less and less weight over time. Because if you start off at 150 kilos and you lose 4 kilos, and then later on down the track you only lose 3.5 kilos, it may be the actual same percentage because you're starting off at a lighter weight. Another key factor that's really important in determining how much patients lose weight on Duromine is usually how motivated they are with their diet and exercise. With all weight loss medication, not just phentermine, all of these medications are used as an adjunct. And a core component of weight loss is still going to be making changes to the diet and exercise. So how long can you use phentermine? Well, this is different for every patient and it really depends on a number of factors. I usually monitor my patients very closely, and if my patients are doing really well, they're losing weight, they have no side effects, and they are at a large weight where they will get a lot of health benefit from continued weight loss, then there's no reason why I don't continue. But it's really important that I monitor these patients really closely to make sure that there's no side effects from the treatment. So if you're interested, make sure you see your doctor to assess you to see if you're appropriate to use this medication. So that's my review of phentermine. If you found it helpful, make sure that you like and subscribe, and I'll catch you in the next video.